This program made possible in part by grants from the UCF College of Health and Public Affairs, which promotes excellence in undergraduate and graduate education, research, and community service in health-related professions and public affairs. And the UCF College of Medicine, where our goal is to become America's leading partnership medical school and a national leader in medical education and research. And the UCF College of Nursing, which offers high-quality, innovative academic programs that reflect the healthcare needs of a changing population and meet the needs of today's students.
Hello everyone, welcome to For Your Health. I'm Ed Highland.
And I'm Charna Davis-Wiese. Coming up on today's show, we are an increasingly global society, which means we need to turn our attention to global issues such as healthcare, disease, and poverty create complicated, sometimes overwhelming problems in some parts of the world, but researchers are working toward solutions.
But first, an update on health news from UCF.
Hello, I'm Karen Guin with a news update from UCF's College of Health and Public Affairs. The director of UCF's undergraduate program in athletic training, Kristen Schellhase, has received a top national honor for providing outstanding advising to students. Schellhase received the 2007 New Faculty Advising Award from the National Academic Advising Association at its annual conference in October. Schellhase has been director of UCF's athletic training undergraduate program since 2004. She had previously worked as an athletic trainer in UCF's athletics department. Last summer, Schellhase was invited to be the athletic trainer for the U.S. Under-21 women's national basketball team during the World Championship Games in Moscow. The team went on to win the gold medal. During the games, Schellhase learned that there are few, if any, athletic trainers in other countries. She returned to the United States with an even greater appreciation for the education athletic trainers receive here and a desire to make athletic training education in the U.S. the best it can be. For information about UCF's athletic training program, visit the address shown on your screen or call 407-823-0010. I'm Karen Guin from the College of Health and Public Affairs.
If you're a person who stays close to home, you probably don't give much thought to malaria. It hasn't been an issue in this country for generations. Outside of the United States, though, malaria remains one of the world's biggest killers, so much so that Bill and Melinda Gates recently pledged $1 billion to help fight malaria. As Alicia Callanan Mandigo reports, part of that fight is taking place on UCF's campus.
Unless you're a person who does a lot of international travel, you probably don't give a lot of thought to malaria. But you should, because it's still a pretty significant problem.
It afflicts about half of the world population, mostly in the tropical and subtropical region. It kills about 1 to 3 million people each year, and mostly children. And its estimate is that a child dies every 20 seconds, somewhere in Africa.
Dr. Dipopan Chakrabarty is researching the malaria parasite itself, which is spread by mosquitoes. His lab is also trying to develop some new drug targets against the disease.
Well, the problem is there's no effective the vaccine against the disease. And the second thing is that the parasites develop resistance to available drugs in a very short time. So in order to cure the disease, you need to keep on producing new generic kinds of drugs. And the second thing is that in spite of 30, 40 years of vaccine research, there's no effective vaccines available.
Anyone who spends time outside in Florida knows we haven't exactly gotten rid of the mosquito, but malaria hasn't been a problem in this country since World War II. That doesn't mean the threat for us is over.
A couple of years back, there was a report that someone who has never traveled outside the United States, living in Michigan, got the disease. The reason being because we have, the people are traveling, the world has become smaller. And when that happens, then the people travel and they are bitten by mosquito in the malaria endemic area. You go to for either for business or pleasure, you travel to a malarious country and you are bitten by mosquito. Then you come here, you do not detect the disease because it needs an incubation time, and you have the disease here.
Since the disease develops drug resistance so quickly, labs like Dr. Chakrabarty's are constantly challenged to find something new. Hopefully, new answers will come before malaria spreads to areas we currently think of as being safe. I'm Alicia Callanan Mandigo for Your Health.
According to the World Health Organization, malaria stands in the way of global economic growth because investors are reluctant to pursue industry in areas where malaria is a risk.
Malaria is just one of several global health issues being addressed by researchers worldwide, with headlines about illnesses like SARS and bird flu constantly grabbing our attention. Health issues in places like Africa and South America suddenly become very relevant.
Joining us to talk all about this is Dr. Bernardo Ramirez. He's the Assistant Professor of Health Service Administration. Thank you so much for joining us. This is an issue that is going to become increasingly more important. And I think before we actually even get into the discussion, we have to really talk about what globalization or a global mindset means, because it's not the same thing as thinking internationally or nationally or this country or that country, is it?
Right, you're right, Chandra, and that's true. One of the first things that I talk about with my students is this concept of making a difference between international and global. And we're really interested in global and globalization because international sets up a pace of us and them. Doesn't matter where you're talking about, any country sees their boundaries as national and everybody else's problems are international. I think the world is getting to a point that that's not true anymore. And we really need to look at the issue from the perspective of global, which is us. We're all in the same place. More and more boundaries are more hardly to delineate. And things that happen in one place affect us in other places.
We seem to be in a very difficult position, if you will, in the sense that we have stories that we see in the news about diseases that pop up, you know, SARS in China, or the reoccurrence of smallpox and malaria, as we mentioned, and yet we tend to feel here in the United States we're somewhat isolated from that. Yet, as you mentioned, with a global economy, as a global type of situation where people are coming into this country legally and illegally, those things are on our doorstep on a daily basis.
Absolutely. All of these problems will happen anywhere. Like, people tend to think that, you know, I'm not going to travel, I'm just going to be here, so why should I be concerned about these international problems? But people just get on a plane, go anywhere. We need to be prepared to tackle all the diseases that show up in distant places and can be around our backyard in no time. So.
Such a great example. I had to write this down so I'd remember this. The first SARS case, he traveled from Hong Kong to Munich to Barcelona to Frankfurt to London to Milan to Frankfurt again and back to Hong Kong ill. I think they figured out it was 7 different airlines, 7 different flights before he was hospitalized and before they said, wow, look at this. This is something that's really bad. He's now been all over the world. This one person. And the thing that I wonder about is we have people like the Gateses and Bono, and they're thinking globally and they're putting all their money towards this, yet we have some countries that are not so forthcoming about what's going on. It was, what, 4 months until we heard from China about the problems with SARS, and I bet that's a big problem and a big issue that we can't be alone in thinking globally.
Absolutely. This is also a problem about education, but I think all of us have to do that. And the place to start is our own home. I mean, we need to start with our students, population, to think more globally, because and of course everybody else has to do the same thing around the world.
Where do you basically start with this? I mean, if the diseases are in other countries and coming here, Do we reach out, as the Gates have done, and try to go to other countries and solve the problem there? Or is it more a matter of beefing up and becoming more educated with our current system here in this country? Or is it a combination?
Yeah, I think you have to start in both places. You have to do it at the national level. You have to educate people that these are issues are important, that we're all exposed to risks and all kinds of events, but at the same time we need to collaborate and cooperate with other nations, other of our fellow citizens of the world, and really do global work.
But is it an education campaign per se? I mean, I guess how do you get the word out?
Yeah, I think it's a combination. Everything starts with education. I think information. It's of course information, which is very important, and then it's putting resources on that, like some people are doing, and the university does, by incorporating international issues, global issues in their goals and objectives. And so now, as you know, every class in UCF has to have some global sense, so they have to incorporate something in the curriculum, something that makes students aware of that, and that's very important. We actually have an opportunity every day to practice this global idea, because we think we need to wait until we go to an extravagant country or an exotic place to think about global issues, but we really do it every day in our work, because we are a melting pot of diversity, and it's very easy to find people from other cultures, other backgrounds, other ethnicities, that believe in different things, that act in different ways, especially when it comes to health care. And so all of these you don't have to wait until you go to another country and practice it. You have to practice it almost every day with the community that we serve daily.
Especially in Central Florida, because people come from all over the
Absolutely.
world here all the time. And we were talking a little bit earlier about diseases that have been wiped out here in this country. Yet a lot of people are thinking, okay, we can let our guard down, and for whatever reason, maybe children aren't being immunized, and then these diseases could be rampant and major problems in other parts of the world, and people are traveling here every day. We could be exposed to whatever and not know, and you can't let your guard down, can you?
Absolutely, we have to keep on guard, and I have the experience of working in many countries, and many times their economies have gone down, and so they kind of also down the guard on these diseases, or there are moments where they have immigration from neighboring countries that come into their countries. They don't watch enough to strengthening these measures of preventive medicine. And we've seen places that had had very little or no incidence of a disease, and with these changes, it comes back, and so some things that the countries thought they had control, they return, and they become a public health or personal problem. So that could happen to us, and that's why it's very important to keep up with vaccination, preventive programs, doing basic things, washing your hands, making sure that you are mindful of preventive care.
That sign's not only for the employees of the restaurant.
Yes, exactly. Everyone involved.
Everybody.
We're going to take a short break and be back in just a few minutes talking a little bit more about global health issues with Dr. Bernardo Ramirez, and also update you on our new medical school. Don't go away. And we're back with Dr. Bernardo Ramirez. We're talking about global health issues. And Dr. Ramirez, if you would, one of the things you mentioned just a little bit ago in the interview was all of us getting together. And often we see that in this country where we will have people from two different cultures. One may be the doctor, one is the patient. And in our prior conversation, we were just talking a little bit about how sometimes those cultures really have difficulty talking to each other and understanding the sensitivities of each other's competence, if you will, and culture, and how that affects the treatment methodology.
Exactly. I think that's a very practical way to look at globalization and global issues. As you know, we encounter very often patients that are from a different ethnic background or a different culture, a different country, a different religion, the diversity in many ways. And from the provider, being the doctor or nurse or any other health provider. And it's now documented very well, and it's a recent research that has done that if there's no cultural competence, if there's no cultural sensitivity to begin with, and then cultural competence to address treatment of patients in ways that it's clearly understood by both parties, then the treatment, the results of treatment, the effect of treatment, basically diminished by an important factor. So that has become very important to think about that, and again, to do that, to be cultural aware and cultural competent. One of the best ways to do it is to look out of the world and look at the people that come to us, that they belong in communities that are where they are the majority, and they have beliefs and ways of doing things, and we need to understand those. So when we treat them, we are aware of that, and we can exercise our cultural competence. Actually, one thing that I think is very important is that cultural diversity is really a strength. Sometimes it's seen as a weakness, like a minority group is like something that we don't know how to handle. We see as a weakness. It's really a strength, because when you look at the way they behave, their beliefs, there are many things in their culture and their behavior that it's really very positive, and we can learn from that. And of course, use it in that particular case, and maybe use it in other cases as a way to enhance our treatment and the way we deal with patients. So that's very important.
Sometimes I think about and worry about it. Ed and I have probably been in the news business more years than we probably care to say, and we know the workings of it. And when there's a slow news day or something else is going on, we may not talk about the avian flu or SARS, and then it disappears from the headlines, or it disappears from the airwaves, and people may forget about it. That this is not a problem anymore. Measles is not a problem in Africa, or tuberculosis is not a problem in Africa, because we don't hear about it unless Bono or Bill Gates comes out. Is that a threat to helping contain this by not having it in our awareness?
I guess you could say that, that in a way, if it's not present, you tend to think that it's gone, and
SARS,
it's not.
We don't hear about SARS anymore, but it's still there.
The fact of life is that all these diseases are there, and many more that we don't hear about, and so it's a constant. That's one of the things of public health. That's why public health is so important. Sometimes it's kind of invisible in communities. You probably never talk to your public health official in your county or in your neighborhood, but they're very important because they play that role. They monitor these diseases. They keep awareness of what's going on, and so public health it plays a very vital role in society, and sometimes invisible until we see one of these problems, and then we know what's going on.
Are you seeing that the research effort is helping us or hindering us? And the reason I ask that is often we're making tremendous inroads in fighting diseases with new antibiotics and new treatment methodologies, but then we turn around and see the headline another day it says we're becoming resistant to various diseases because of the new medications. And that's in this country, and in other countries they're running into the same thing, where a simpler, maybe an old-fashioned remedy may be just exactly the medicine they need.
Well, I think there's no question about that research and science really makes our life better, and it's a way to go and improve the way we deal with these diseases. The problem but what you're saying, like resistance to some drugs, or it's really the maluse of these drugs. I mean, like, people need to be educated, both clinicians, but mostly the population, and that's where this cultural awareness and competency comes from, because you need to know how to convey those messages to different populations so they understand that for instance, antibiotics create resistance. So it's not that you just don't want to put them on the shelves in drugstores just for the sake of it, but because there is a problem in doing that. And so I definitely think that research and science is the way to go. And it's just that we need to be careful that we don't misuse science and research or not get enough information about it to deal with these problems.
And it's a way that we, like you say, we can all do something about it. When your doctor gives you an antibiotic, if it says take it for 14 days,
exactly,
there's a reason. It's you feel better, but you're going to not only alter your body, maybe alter the entire strain. It's every person has a ripple effect and affects everybody.
Exactly, and that's exactly what we're talking about. That, 14 days for a lot of people is different things. You and I think different. So when they say 14 days, people say, okay, more or less 14 days. Some other people say 14 days, and it's 14 days. So if you understand that, you need to make sure that you convey the right message, and you tell them why 14 days, and you make sure that they will follow the treatment, because that's very important.
Dr. Ramirez, thank you so much
for
teaching us how to think globally.
It is something we all should be doing on a daily basis, as you say.
Absolutely.
Thank you again. Well, there are lots of changes and new plans for the UCF College of Medicine coming to our Lake Nona campus in 2009. Here's our latest update.
We've gone from 1 employee to more than 150. And that's a long way to go. We've put together an educational program. We've built our curriculum. And in December, the Liaison Committee on Medical Education visited us. And they are writing a report, and we should have the results of that report and its outcome sometime in February or March. And that's a critical time for us, because at that time, we will know whether or not we've received the preliminary accreditation that will allow us to open our doors to students. And that's the kind of overarching timeline. But in between that, there are so many people who are working on this for us. And not only the 150 that are now employed by the College of Medicine, but this community. We've had input from the university community, from the physician community, from our hospitals, from our legislators, and there are so many things going on. Most people are aware of our scholarship initiative. We plan to offer full scholarships, tuition and living expenses for all 4 years for every student in our inaugural class. And that will be a first in the history of medicine in this country. So we're hoping that once we reach that goal, and once we're allowed to recruit our students, we'll be able to start off with the best students to help us build our medical school as we go forward.
Just as medicine continues to expand its global view, so does the field of social work. In fact, the career of one current graduate student is taking her to some unexpected places.
This might be your idea of what a social worker does, but this was Amanda Colton's idea. Amanda is a UCF graduate student completing her master's in social work. As part of that, she went to Guatemala for a research project.
For me, I wanted to really comprehend the Latino community that I work with so much here in Central Florida. And Guatemala was great because I've already visited a couple different countries in Latin America, and I wanted to go somewhere else. It was cheap to stay there, but also it gave you a lot of outlook within adoption and foster care there.
The opportunity arose after Amanda approached one of her professors and asked whether she could pursue her own research.
We decided on adoption and foster care. We went over a bunch of different topics, primarily because what I do here in the States deals with adoption and foster care, and I want to work within the foster care realm as I continue to grow in my professionalism in the work field. With her knowledge base and my knowledge base, Guatemala got to be the location of choice.
All of this may seem a world away from Guatemala, but it's really not, especially when you consider how rapidly Orlando's Hispanic population is growing. So experiences in Guatemala or other parts of Latin America can be put to work right here. And that's exactly the kind of research Dr. John Brico is hoping to develop at UCF.
The idea is that we would like to expand the scope of the research that we conduct in social work. And also we'd like to expand the outreach into the community. So we'd like to be doing more research, and we'd like it to be more relevant to the community.
Which, as Amanda discovered, can create some compelling career opportunities.
It's such an interesting field because you can do so much with it. You can do counseling, individual counseling, clinician sessions. You can do case management and help a family become stronger in their area. You can go in human resources and businesses and help actual people who are going through crises within the corporate area. You can work with any population that you can imagine.
It's work that really allows for human exploration, whether it's local or global. I'm Alicia Callanan Mandigo for Your Health.
So that's going to do it for this show for us. I'm Charna Davis-Wiese.
And I'm Ed Highland. Thanks for joining us. We'll see you next time on For Your Health.